I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. We're here once again today to provide you with the most up-to-date information about the COVID-19 pandemic. This press conference is broadcasting on County TV, Channel 20, and the county's YouTube page. A Spanish language interpretation by Carlos Saraceda will be available on the county's website and YouTube page shortly after we conclude the press conference. And the meeting is being interpreted in American Sign Language by Kim Rich. Yesterday at the County Board of Supervisors meeting, Dr. Del Reynoso shared the Public Health Department's local COVID-19 modeling for the first time. The most important takeaway from Dr. Del Reynoso's presentation was to show the powerful effectiveness physical distancing can have on stopping the spread of the virus, flattening the infection curve, and reducing the patient surge to our medical system. I want to say this again to emphasize this very important point. The graphs shared with the Board of Supervisors were intended to illustrate how different levels of physical distancing can dramatically flatten the infection curve and potentially match up the capacity with our medical system. This is very good news. The graphs show a direct connection between what each of us is doing to stop the spread of the virus and the lives that will be saved if we continue and even get better at social distancing. Small changes in our combined physical distancing effort produce big gains in flattening the infection curve. The more we reduce infections, the better our medical system can treat patients. It's that simple. Our community is doing very well on physical distancing, and we are all finding new ways to get better at it every day. Thank you for leaning into this very important moment. I have heard directly from many of the community's nurses, doctors, and other medical support staff who are treating COVID-19 patients in the hospital. I've also heard from our county's first responders, who are the first people who go directly to the homes of the COVID-19 patients that need help. When I've been out shopping, I've talked to the grocery store checkers and stockers who keep food on the shelves. Many of the hundreds of other people who are working every day to provide essential services that keep our community going have also contacted me. To a person, they want to express their deep appreciation and thanks to our community for stepping up and doing the things that we are asking to help keep them healthy and on the job protecting us. I hope each of you recognize and appreciate how important the contribution you are making by doing the right thing is to our community's health. So once again, please keep up physical distancing by staying home and limiting errands to essential trips. When you have to go out, wear a face covering and stay at least 6 feet away from other people. Wash your hands, don't touch your face. I've actually noticed that it's getting easier to do that. And remember to keep disinfecting surfaces. It's especially important to remember if you feel sick, stay home and isolate yourself. If your symptoms worsen, call your medical provider or the county clinics, and they will give you advice as to what to do next. If we all practice these simple but powerful steps, we will get through this together. I've also heard from a number of faith leaders about innovative ways they are planning to celebrate the upcoming religious holidays virtually. Tonight, Rabbi Steve Cohen and Congregation B'nai B'rith will be celebrating a Passover Seder with more than 200 local families using Zoom technology. What an incredible, creative way to knit the congregation together while still keeping physically apart. Tomorrow, Father John Hedges from St. Athanasius Church will join us to speak about the importance of practicing physical distancing during religious holidays because we are stronger together, safely apart. Finally, I'd like to mention yet another inspiring story of generosity and kindness. Daniel Goldberg, a local San Marcos High School junior, has created a grocery delivery service called Zoomers to Boomers. Daniel and a few of his friends wanted to do something to help out during the COVID-19 crisis. They recognized that many seniors needed assistance getting groceries delivered to their homes to avoid exposing themselves to the virus when shopping. This genius cross-generational idea has proven so popular and successful, there are other chapters popping up around the country. To date, there are 10 cities that have joined this effort, and there have been inquiries from as far away as Australia. To help Daniel and his fellow Generation Z volunteers with this effort, go to zoomerstoboomers.com, zoomerstoboomers.com. Thank you, Daniel, for inspiring our community when we can all use some good news. I'd now like to introduce the county's Public Health Director or Officer, Dr. Henning Ansorg.
Thank you, Supervisor Hart. Good afternoon, everyone. Let me give you today's numbers. Today we are reporting a total case count of 228 in Santa Barbara County. The ages of the new cases range from the 30s to over 70 years old. The breakdown of the locations of the cases will be shared in a press release to follow and on our public health website at publichealthsbc.org. Of the 228 confirmed cases, 112 of them are recovering at home, 69 have fully recovered, 37 are hospitalized, 17 of them in the intensive care unit. On 8, we are awaiting an update for our disease control team on their status. 2 persons unfortunately have died. We continue to see an increase in confirmed cases across the county of Santa Barbara. However, the increase is following a linear pathway and has not evolved into an exponential pattern, which we initially were worried about. The fact that our numbers are increasing along such a linear path is reassuring and is a direct result of our community's concerted effort to slow down the spread of the novel coronavirus and flatten the curve of cases. With this development, I now can comfortably state that we as a county are meeting our ongoing goal with our efforts to limit the spread as much as possible in our geographic area. At such a time, when we all can be reassured our efforts are working, we must still remember not to waver in our adherence to physical distancing, wearing face coverings, and practicing exceptionally good hygiene. Currently, we are dealing with one outbreak in a congregate setting, the Federal Correctional Institution in Lompoc. A number of inmates as well as prison staff have tested positive for COVID, and we are actively cooperating with the prison administration, their medical team, and infection control staff to stop the progression of the outbreak and contain it as much as possible under the circumstances. At last check with our epidemiology team, 30 inmates and 14 staff had tested positive for COVID. We did receive the additional 200 testing kits for use in our Santa Barbara Public Health Lab, and this is an important milestone in achieving faster results which facilitate immediate isolation of positive cases and quarantining their contacts. At this time, from the Public Health Department, we want to thank the community for doing their part in fighting this epidemic by adopting the physical distancing mandate and making such a wonderful communal effort. We know that it is making all the difference, and it has already saved many from getting ill or losing a loved one. Thank you.
Thank you, Dr. Ansorg. Next, we'll hear from Dr. Vonda Reynoso, the Director of the County Public Health Department.
Thank you, Supervisor. So as Supervisor Greg Hart mentioned yesterday at the board meeting, I shared the results of our modeling efforts, which were based on our population, our total number of cases, number of cases hospitalized, and the different levels of social distancing. And I invite you to view the modeling efforts at our website. But essentially, at the 40, 45, 50, 55%, we see a remarkable impact on our healthcare system. These models were based on real-time data as of April 6th in our county. And as we input different real-time data, we'll see a little variation in the curves. And as we flatten the curve, we will see that it will stretch over a longer period of time. And this is the nature of the modeling. And I think that it's really important to remember that as we consider these models, they are not predictions of what will happen, but instead they're really good planning tools designed to help us understand what might happen in different scenarios or set of assumptions. And regardless of the different models being introduced out there, regardless of the models that we've ran, they all rely on one key criteria. It's all based on our estimated adherence to social distancing. So we can realistically estimate that we as a community are compliant 40–50% of time. But if we can just eke up to the 55%, we can sustain our local healthcare system during this pandemic. Nevertheless, our county is ready and actively preparing in any scenario. We have planned a phased approach to address these scenarios with our hospital surge planning, arrangements for alternate care sites, and aggressively requisitioning medical equipment. And again, I can't underscore that social distancing is the greatest driver in both the timing and the severity of this pandemic. The lower levels of social distancing predicts cases would peak earlier, with thousands of people needing hospital beds and ventilators. Higher levels of social distancing predicts cases would peak at a later time with lower hospital census and lower ventilation needs, not exceeding current capacity. So again, on behalf of the Public Health Department and our local health system, thank you for being diligent with social distancing during this unprecedented time. And I want to leave you with a PSA. In addition to social distancing, washing your hands, not touching your face, I really want to thank all the community members out there who are creating these face coverings, and thank Miriam and Lee in particular for my color-coordinated gift today.
Thank you, Dr. Durganoso. I'm also pleased to introduce today Judith Smith-Meyer, who is here from the Food Bank of Santa Barbara County to tell us about the important work the Food Bank is doing to get food to county residents in need of help.
Thank you, Supervisor Hart. The Food Bank is really proud to be of service to the community at all times, but this is really a wonderful test of our capacity. I want to say first and foremost that if you need help, if you need food delivered to your home, if you're a senior, or if you need to find out where you can get food, if you've recently lost a job or have any other reason that you need food, healthy food, call 211. This is the main message that we have for you today. You can sign up for senior home deliveries, and you can find out your nearest location where you can either drive through and have a no-contact food distribution opportunity, or you can go pick up food somewhere near where you live. To everybody who's facing food insecurity for the first time, this is a special message to you. The Food Bank of Santa Barbara County is ready to serve the entire community, and we are here for everyone. Please do not hesitate to come out for food if you find yourself struggling to make ends meet. This is a health crisis. This is no time to try to eke by on instant ramen or other super cheap prepared foods. You need to keep healthy, and good nutrition is one of the key components of being able to do that. The Food Bank's response to the COVID situation is driven by safety first. Absolutely, our first priority is everybody's safety. And we have established what we call the Safe Food Net, which includes the no-contact drive-through food distributions that I mentioned. We have set up 15 of those throughout the county so that every region of the county has access to that. We are offering senior home deliveries to all seniors who were previously enrolled in our brown bag program, which is a low-income seniors food distribution program. They were all automatically switched over to home deliveries, but we are offering free food home delivery to your door safely to any senior in the county aged 60 or over, or 55 and older if you have a disability. No paperwork is required for these deliveries. Just self-certify that you need it, and we will bring it to your door. To make that happen, I just want to say that we have been working with many wonderful partners. I'll mention in a little bit. We are certifying that every partner we are working with to deliver food, to pack food, our volunteers are all adhering to this, our staff is adhering to this certification that we are all using personal protective equipment, that everyone is exercising strict physical distancing, and that safe food handling is being used at every step of the process. That includes when it's delivered to your door, the box or bag will have a label on the outside with safe food handling recommendations for how to open the box, leave the box outside, and so forth. And then inside there's a flyer about what to do to keep yourself as safe as possible when you take the food into your house. That's all in English and Spanish. We're committed to trying to make sure everyone in the community has access to guidance about how to keep safe with food. And then finally, we're prioritizing the safety and wellness of everybody on our staff, everyone who volunteers with the food bank. We are still actively recruiting volunteers. We expect this to go on for a long time, so more volunteers are always welcome. Some statistics: we have 50 of these safe food distribution sites. 15 of them are brand new. All the brand new ones, as I mentioned, are drive-throughs. So the way it works is you drive up, you roll down your passenger window, someone 6 feet from the driver says, how many in your household, what's your name, and is this the first time you've received food this month? Take that information, drive to the next station, pop open your trunk, or unlock your back door, and the food is placed inside your car, closed, and you drive away. So there's absolutely zero contact at any of our drive-through food distributions. You can also walk up. The food has been pre-bagged in a safe situation, and we're exercising physical distancing at all of our distributions. So you're safe no matter how you are able to get there. We have distributed more than 1.1 million pounds of food in the first month of our response. That's a 100% increase year over year. We're averaging a distribution of 77,000 pounds of food per day. That's 2 giant truckloads of food. We're really pleased that we're able to maintain our 50% fresh produce ratio throughout this process so far. That's due to lots of amazing relationships with growers, distributors, wholesalers, retailers, restaurants, community members who are dropping off bags of oranges from their trees. We're grateful for that. We have provided 3,600 home deliveries to seniors throughout the county. That number's growing by about 100 a day. And we're taking 100 phone calls a day at our 211 call center. So again, call 211. People can give you, our volunteers can give you information in English and Spanish about where you can get food closest to where you live and how to sign up for home delivery. We have also leased 2 additional temporary warehouse spaces, one in Santa Maria, one in Santa Barbara, to deal with both our greater food storage capacity needs and also to provide space to accommodate our volunteers to work. Previously in our warehouse spaces for volunteer packing of bags and boxes, we could accommodate 15 people at a time. With physical distancing, we could accommodate 6. So we, in addition to storing the food in these additional warehouses, we are accommodating safety measures for our volunteer staff. We've spent $200,000 on the purchase of food that's hard to get donated. That includes hard to get donated staples, eggs, and fresh produce. Things we have coming up that are in the works that we're excited about. One is we're piloting a prepared meals program that we're working with local restaurants to provide fresh and delicious meals to our senior home delivery clients. And this will sort of give food bank supporters a double impact with their contributions, that we're helping seniors get great meals, and we're also helping local restaurants keep their staff employed and keep going with the businesses. So we're super proud of that and look forward to rolling that out in the coming weeks. We're also going to implement a text program where you can text your address to a phone number and in English or Spanish receive information about the 3 food distributions that are nearest to where you live, and receive other food-related updates. So that's coming in the month of April as well. I want to say, personally, I'm super proud to be part of the food bank right now. We are really ready for this emergency based on lessons that we all learned as a community from the Thomas Fire and the 1/9 debris flow. Basically, that food, providing food for people in Santa Barbara County in the case of a disaster is going to need to happen near people's homes or at people's homes. We learned this happened when you have 6 feet of mud in your driveway, or if the freeway is disrupted and other transport channels are disrupted. Of course, we had no idea that we would be devising a plan that would apply so perfectly to a kind of situation that we're in right now, which none of us foresaw. The other thing we learned after the Thomas disasters was that we needed to build stronger relationships, collaboration, and communication to make sure that everyone in our community can really have all of their needs met. In our case, for the food bank particularly, that they can have enough healthy food to eat no matter what disaster comes our way. To develop the feeding plan, we worked with County Office of Emergency Management, Departments of Public Health and Social Services, city administration throughout the county, fire, law enforcement, the healthcare, education, and nonprofit sectors. Our huge nonprofit partners in that program were Red Cross and Salvation Army, and many more throughout the county. So because we have this feeding plan in place, which we just published last November, we are truly ready to face this moment with confidence and to make sure that everybody in the county facing need has the food that they need to stay healthy. And we're expecting this is going to be a sustained effort, so even after stay-at-home orders are lifted, the economic impact will be really long-lasting, and as the community recovers long-term, the food bank will continue to be sure that everybody has enough food to eat to stay healthy. We definitely want to thank our partners and our community for all your support, coming out volunteering. Of course, financial donations are hugely helpful, especially as the situation goes on and on for months. And our hearts definitely go out to everybody who's facing illness right now and who are facing the economic impacts of this pandemic. Thank you.
Thank you, Judith, and thank you to the whole food bank team. I had an opportunity to visit to thank the volunteers that you have working, and it's an incredibly well-oiled machine that's doing important work protecting our community from food insecurity. So thank you again.
Thank you.
Next, we'll take questions from the room. Ms. Lair?
I have one. I'm News Channel reporter Tracy Lair, and my question comes from a producer who was wondering about those infographics, I believe, that were presented at the supervisors meeting, and one that had a projection of social distancing lasting through November that spurred a lot of people commenting on social media that seemed like a long way to go, and a little bit of panic came out on social media. And we're wondering why that projection when other places aren't doing that. And I'm thinking Dr. Del Reynoso can answer that.
Sure. So the model as it stands today, we use the Penn-Chine model. And so typically it is for 100 days. But at 100 days, if you run the model, it's an unfinished curve. So it leaves you wanting what happens to the other half of the curve. And so we chose to run it through the whole bell curve just to project out what the future might look like. And so, as I mentioned during the board meeting, that beyond 100 days, the model gets a little unwieldy. And so that is just a projection of what the curve might look like in completing its course. And so I imagine that as we look at the data and as we run the model with additional real-time data on a daily basis, we're going to see different dates.
And since I have you, last meeting you mentioned you were asymptomatic, meaning you don't have symptoms and that's why you never tested.
You know, I think I did say that. Given the limited number of testing available, and given that we as a community have committed to a tiered system, unfortunately, I don't fit into the Tier 1 category, and nor is any of my family members. So given that, I'm taking all of the precautions to protect others around me as well.
Okay, and finally, Dr. Ansorg, if you're a math geek, you might do the math of per capita and see that the numbers are higher here per capita than Ventura County. Could you comment on why that might be?
Well, there's a problem with the numbers, and the big problem is that we do not have an accurate count of tests that were actually run. We do have an accurate number of positive tests, but we do not have an accurate number of how many tests were really done. The reason for that is that every provider, every little clinic who runs the test would have to call it in or enter it into a computer system, and sometimes that is too cumbersome or it gets forgotten. Another reason is that states where labs were used that are out of state. For instance, one is in Austin, Texas, and and one was is out of Phoenix, initially was out of North Carolina, and therefore they were not integrated in our California CalReady system. So the numbers are skewed, and I don't think it's a fair statement at this point that our per capita positive rate is higher than Ventura. We would have to have real data to make that assumption.
Any other questions in the room? Mr. Dreyfus?
Yeah, just a quick question. Is there a plan for the uninsured if they get sick and have to be hospitalized? Like, is there going to be state funding or city funding or county funding to help those with financial burdens of going to the hospital?
I'm not sure about that, but I know that as a clinic system, we are making sure that anyone who has symptoms or feel ill with flu-like symptoms or COVID-like symptoms can get medical care at any of our 5 clinic systems free of charge.
And if they have to be hospitalized, does that also fall under the clinic system?
No, so the hospital is a different clinic system, but I think that under this unprecedented time, I'm sure that things can be worked out between the hospital, the patient, and our healthcare system overall.
Any other questions here in the room? Next, we'll go to calls on the phone.
Yes, we've got Reza with San Ynez Valley Star. Go ahead.
Hi, everyone. Thanks so much for taking my question. I've had a few readers reach out to me, several in the healthcare industry, that are wanting to know how many false negatives do we think we've had in the county, and what is the review process for a negative test result? Is someone looking at those results and considering patient symptoms or radiological studies to see if they, send the test back to keep them quarantined?
We currently we are not testing people who have recovered. That was only the practice in the very beginning of the epidemic or pandemic, when the first patients had to be hospitalized and we didn't know when they would be safe to be released. The tests that we currently have tests for virus RNA that is still there. So it does not really check your immune system if you had a response with your immunoglobulins or anything. Those tests are in development right now, and they will be very helpful in the future to answer your questions. But at the moment, we do not have very good data on false positives and false negatives, because everything is just developing so fast, and so many different test platforms had to be developed in such a short period of time that those data are not easily available yet.
Okay, I have several other questions. After the presentation by Ms. Del Reynoso yesterday at the Board of Supervisors, several readers reached out to me as well and said that they can't last through November with social distancing. They have to get back to work. And I just wonder if there was any economic impact included in your modeling, because people are losing jobs. And I understand, the food bank has an amount of food and fresh food. Thank you for that. But with the stress and anxiety, that also causes your immune system to fail, and then people will get sick. So I'm just wondering how the economics of this is playing into your modeling.
I totally can relate to the impact of economics during this shelter in place. My family as well. I can share with you that my husband is furloughed from his job during this time. So as a family, we are experiencing some hardship that I can understand. So my family and friends in the same boat. With that, unfortunately, this model is anticipates hospitalization, ICU, and ventilation. So it does not look at the economic costs. But what I can say is that it is dependent upon the shelter in place currently. And I believe that we will be following the state's direction on the furthering of the shelter in place. So right now, I believe that the governor's shelter in place is effective through April 30th, and we will be running models with our real-time data as well as the projection of the impact of April 30th and beyond.
Okay, thank you. Those are all my.
Thank you, Reza. Next on the phone?
We have no other questions.
Okay, great, thank you. Our next press conference will be held tomorrow at 4:30 p.m. Next week, we'll not have a press conference on Monday. Instead, the Board of Supervisors budget workshops will include a COVID-19 presentation from staff at 9 o'clock in the morning. The regularly scheduled 4:30 p.m. daily press conferences will resume next week, Tuesday through Friday. And then the phone numbers and website addresses for resources for community information about COVID-19 will scroll on the television screen immediately after our press conference concludes. Thank you for joining us today. Please stay healthy and apart.